Hello, everyone. I'm Leah Binder. I am President and CEO of the Leapfrog Group, and I am here today joined by a good friend of Leapfrog, Lisa Zierten. We've worked together for several years now. She is with Sodexo, and she's going to talk with us a little bit about, first of all, some of the work that she's done with Leapfrog and as part of Sodexo on some very important issues on environmental services that I think hospitals should pay some really close attention to. In addition, we are going to just do a little teeny preview of the article that we are posting today as part of the Environmental Services Work Group that Lisa spearheaded the development of, and it's posted right here on LinkedIn right now. So let's start with you, Lisa. Tell me about yourself.
Sure.
What role do you play at Sodexo, and where did you
Yes. Well, thank you, Leah. It's great to be here. Yes, I've been with Sodexo now for 4.5 years, and I lead our marketing efforts for what we call our soft and hard facilities management services, a large proportion of which are environmental services. So that's really cleaning and disinfecting healthcare spaces, hospitals, outpatients, areas as well. So that's basically the main part of my job. I also have experience in the past with various companies. So I worked for a large healthcare distribution firm as well as a company that developed personal protective equipment as well as sterilization equipment as well. So have a fairly well rounded background in healthcare products and services. With
Well, you've done
Sodexo, oh, go ahead, please. I was just going to say, Sodexo, for those of you, the folks who are listening to this don't know, we provide support services for hospital customers as well as other verticals. But most people know us for our food and nutrition services. We've been providing environmental cleaning for over 30 years, however, and our number one mission with environmental services to ensure that the hospital is clean, it's disinfected, and it's safe for patients, staff, and visitors.
what I was going to say is I think organizations, companies like Sodexo and people like you have really you're kind of the behind the scenes people saving lives. I mean, this is really important work. We all depend on when we go to God forbid, go to the hospital or go to any healthcare setting, we're really depending on the fact that these are clean and disinfected. I mean, that's really important to us. We just assume it's done very, very well. And so I salute you for this really important work. It's very behind the scenes. You're not the ones that are going to get all the credit all the time. So here's a little credit. Hats off.
Thank you. Thank you.
So now you've been active member of the Environmental Services Work Group, which is a part of Leapfrog's Partners Advisory Committee. You've done that since the inception of that EVS work group, which I think it was 2 years ago. So tell me why do you think that's so important for you to be part of that at Leapfrog?
Yeah, well, one of the reasons that, we were very interested in joining together with Leapfrog is your mission of patient safety. And it's very aligned with our mission in EVS at Sodexo, which is to, like I mentioned before, keep patients safe. I was looking at information from the NIH the other day, and healthcare-associated infections, HAIs, in other words, cost hospitals between 25 and 45 billion with a B annually. It's a significant impact to them, but the more serious impact is to patients. Over 2 million patients contract HAIs annually here in the United States. There's over 90,000 deaths as well, very sadly, because of this. And very often EVS is sort of that first line of defense against HAIs. And we take our roles very seriously. Our teams are very serious about their jobs and very committed to making sure that we're doing everything we can to maintain that level of safety in that first line of defense.
Well, what I appreciate is that Sodexo and through you and your leadership has come together with others in this space and in the space in general of organizations that are interested in environmental services, we want to make sure that the US has the best possible environmental services. So what do you see as potential trends in EVS as we look ahead?
Yeah, I think one of the things that we hear a lot from customers and from our teams as well is, while job number one is safety, it's not just safety first. It's what one of my colleagues says, safety always. There's also sort of these competing priorities within hospitals, right? For cost efficiency, for moving moving patients through the hospital in a very efficient manner very quickly. And so, we're constantly having to sort of balance the quality and the safety piece with the productivity of our teams, as well as right sizing the service level. So making sure that we have the right number of people to do the job, but not necessarily having that luxury of having a lot of extra folks available and on call, so to speak. So it's a continuous challenge. And I think some of the trends that we're seeing and some of the things we're looking at is automation in digital platforms that can help enable our teams to do their jobs in a as efficient a way as possible. So it used to be where records were kept on pieces of paper and Excel spreadsheets, and schedules were generated on paper and posted up on a bulletin board. And it's just in this day and age, it's not the way to efficiently run a service or a business, quite frankly. So we're seeing more and more interest and more advancements in the area of digital technology to enable some of these behind the scenes teams, right? So it's not just about improving medical technology and clinical technology, is how do we enable everybody who's behind the scenes to do as good a job as possible, right? So we have platform that basically helps us to manage the entire program, our EVS programs for our teams, and enable scheduling and workforce management. We can have all the information on quality assurance measures that we take. The training is available through there, and all the way onto a cell phone or a tablet that our workers might have. So it's really sort of a game changer for us, and it's something that we continually look to improve upon, put more control, more visibility into what's happening into our clients' hands, and then more control and ability to do the job quicker and better into our employees' hands.
And is that helping you to make the case for the cost efficiency of the investment by a hospital? I know that's always a challenge for hospitals to maybe put the priority on environmental services the way I think many of us would like to see. Does it help that you've had these sort of innovations from the digital side that may make it more efficient?
Yeah, absolutely. So data is really, having that visibility into that data and what's happening with the program is extremely helpful. Yeah, I'll give you one example. We are using Internet of Things sensors to basically track traffic in and out of public restrooms in a hospital, for example. So, prior to having this data on how much traffic was going in and out of these rooms, we would just schedule cleaning and policing of the restrooms on a regular basis, I don't know, every 15 or 20 minutes, whatever made sense. But now that we have this information, we can truly understand, how many people are going in and out? When are they going in and out? Do we need to be sending somebody there as often as we do, or can we pull back a little bit on that and then reallocate that worker's time to something that's a little bit more critical, like cleaning a patient room, for example? So
Mhm.
that's the type of thing that we are using technology to do. And to your point, to right size the service level and making sure that the staff is really focused on the truly critical parts of cleaning and disinfecting a hospital.
That's a terrific innovation. So how can hospitals create a culture of safety around really addressing EBS-related pathogens. Are, you've talked about some efficiencies that can be put in place, but what would you see as training programs or other uh, other real strategies to really prevent transmission within hospitals, which we do know is a big problem.
Yes, yeah. So I think the first thing that I would recommend that we do with our teams is to help them really understand the importance of their role and how it contributes to overall patient safety. So drawing those links, is connecting those dots between cleaning a hospital and the health and well-being of that patient, the staff, and even themselves to a degree is really critically important. That's sort of the first thing right out of the gate. We mandate that our teams go through thorough, standardized training, not just on the what we call the 7 steps of cleaning, but on infection prevention basics, right? So we've built an entire training program around infection prevention to help them, really understand sort of what needs to happen, why it's important, what are the standard protocols and procedures that they need to follow, the right PPE to wear, why are they wearing that PPE in what circumstances, for example, good hand hygiene, essentially a lot of things that you would train your clinical staff on. The other thing is making sure that they know how to use the textiles in our programs as well as the chemicals to achieve the best results. So chemicals can have different dwell times, contact times, for example, different use instructions. So we spend a lot of time making sure that our teams are onboarded and understand exactly how to use those products in the right way to achieve the efficacy that is needed on that. The other thing that we do is ensure quality checks. So we're doing a lot of QA checks, either through with black light types of technologies, ATP technologies, as the customer would want us to do, and then looking at HAI data on an ongoing basis as well, just to understand where there might be opportunities for improvement or corrective measures. So all of that data that's being pulled into the digital platform is visible, and we can connect the dots and see what's trending, where we may need to do a little remedial work with somebody, that type of thing. So that's really kind of the core, having all that data in one place to be able to understand how the program is working is really, really critical.
It's interesting when you're talking earlier about the training protocols that are quite complex and really do require EBS workers to be very familiar with infection prevention and protection of themselves as well as patients and the entire environment. I mean, it really does. It's really a reminder that the EBS workforce is very much a part of the patient safety story in a hospital, and
Yeah.
hopefully they're part of the team in a hospital, but not always. So I think that's a really important reminder for hospitals. Are they rounding with you? Are they in the huddle? Are they really considered as really key players? Because without them, there would be many more problems in hospitals, and that would be pretty terrible because there's lots of problems already.
Yeah, absolutely. And that you bring up a really good point. And that relationship between the EVS team and the clinical staff, and it's not just the IP staff, right? It's the staff on the floors, the nurses on the floors. We train our staff to engage and have good relationships with the floor supervisors and the floor nurses so that they can make sure that they're doing the right thing as well, understanding if there's any issues, just that relationship and that communication is really, really the foundation to a good relationship with respect to the EVS teams and the clinical teams. And it just really helps support improvement of outcomes.
And Lisa, one final question. What do you see as the main challenges ahead?
Yeah, I'd say, this is probably fairly universal in healthcare, but attracting, recruiting, retaining good staff is a challenge for everyone right now. We continue to look for ways to build our pipeline of workers, making sure that we're identifying folks that are going to be great managers in the future and giving them the development opportunities that they need. We have other businesses or other services besides EVS. We're in biomedical equipment, servicing types of services as well. So, hiring skilled technicians for that service is very important. So, we've done things over the past several years, like just strengthened our overall employee value proposition, making it more attractive to be part of Sodexo, and just making sure that they have the right support and the resources, the training that they need to be successful in their roles. And then we've done things like implemented pipeline development area actions, like our cadet program in our healthcare technology management, the biomedical management service, and that's to help build that bench strength of skilled technicians that we need to continue to help our customers and have that business be successful. So we're reaching back into community colleges. We're developing programs that will help support folks who want to get training in that area and be able to have career aspirations and career paths as well. So it's for me, that's kind of the biggest issue that
Yeah.
we face with respect to just overall sustainability of our services.
Yeah, it's a big issue in all of healthcare, but I'm sure it's particularly the case where
Yeah.
EVS is concerned.
Yeah,
So,
and I think in infection prevention too, just to
yeah.
one more thing to add, and that's just emerging pathogens, right? So we're seeing some diseases reemerge that we thought were, essentially under control. There's others that are just brand new, or the transmission of disease is accelerating, due to global travel. But pathogens have been with us forever. They'll continue, I think, to be a challenge in the future. So, being there with, really great cleaning and disinfection and vigilance, if you will, is our main way of helping the fight against these things. So,
Important, very important leadership to this very important problem. So I really appreciate the opportunity to talk to you, Lisa. Thank you for the paper that
course.
posted on our LinkedIn page right here, and really for your leadership and participation with the Partners Advisory Committee in general. That's been very useful to Leapfrog and to helping, I think, all of us to understand a little bit better the impact of environmental services on the overall health and well-being of all the patients. So very important leadership, and we'll be watching closely and working with you as we go forward. So thank you.
Well, thank you. Thank you. It's been my honor and pleasure. Thank you.